more information that we did not get at the beginning was that his younger brother, who died in the early 80s at the age of 8, was diagnosed then with leukodystrophy pseudonophylis. It was not genetically confirmed, but actually from the clinical course of the disease, it was the cerebral form of the X-linked adrenoleukodystrophy. The only positive thing here is that the test was negative in DT sister, so that means this is the end of this very sad story. In the meanwhile, a biochemical test that shows elevated plasma levels of very long-chain fatty acids was performed. So now we don't have the doubt that our patient Dan has not only adrenal insufficiency, but also adrenomyeloneuropathy, which is one of the most common clinical forms of X-linked adrenoleukodystrophy. It can be divided in generally 2 clinical forms, with or without cerebral involvement, approximately at the same percentage. And the symptoms and signs, I would not go through these because they are all of them, but I want to stress that the disease progresses slowly within 5 to 15 years. And when Dan left our hospital, he was walking with assistance needed. He had walking difficulties. When just a week before I came here, I met him again. Now he's in a wheelchair with a urinary catheter, and he has paraplegia, actually. So it's the course of the disease is much faster than it is usually in these patients. So we were discussing maybe it is a sort of combination of phenotypes, not only adrenomyeloneuropathy, but as you can see, olivopontocerebellar form that actually includes the brain stem. And it is only of academical meaning because the cause of the disease is individual and the phenotype actually is due to the molecular changes. So what happens from mutation to disease in short terms to maybe go to, through the treatment of the disease is that we have a defect because of the gene mutation of transporter protein in the peroxisomal membrane, which is responsible for the breakdown of the certain types of very long chain fatty acids. This leads to breakdown of the myelin sheet, resulting in neurological problems characteristics of leukodystrophy. The incidence, we say it is a rare disorder, but 1 in 2,000 males and 1 in 50,000 males is not as rare as we do not have them in our statistical evaluation. What a normal course of diagnosing disease would be is if we suspect that based on clinical symptoms that the patient has adrenoleukodystrophy, 2 simple blood tests should be performed. One to evaluate adrenal insufficiency and another to evaluate the a plasma amount of very long-chain fatty acids. I want to stress that the level of cirrhotic acid in plasma does not correlate with clinical presentation. The next step is to perform brain MRI in order to assess cerebral involvement, which is linked to worse prognosis. And of course, the molecular genetic analysis of the mutation of the gene. And today, more than 500 types of mutations of the gene are known. But this, what I want to stress here, and what in this case we have actually, is that the specific mutations present in adrenoleukodystrophy gene does not necessarily predict the course of the disease. That means that 2 members of a single family that harbor the same mutation does not mean that the clinical course of the disease will be identical, which we can see between the 2 brothers, and it can be the same between the uncle and his nephew. And when I come to talk to treatment, I get disappointed. Dan today has only the first replacement therapy for the past 5 years and physical rehabilitation therapy. The Lorencovo, which this movie I started with is based on, does not seem to alter the progression of the disease once the brain is involved. It aids in the normalization of the fatty acid level. And when it seems to be the treatment of choice is bone marrow transplantation, the only treatment that can stop demyelination. But I want to stress that it is not successful in patients with advanced neurological involvement. If the demyelination has progressed, transplant can even worsen the outcome and increase the rate of decline. About his prognosis, and I want to ask you what to tell Dan. Just 2 years before, he had all the mountains in the region under his feet. He was driving bicycles. Today, he only has his wheelchair, and he has only one pebble in his hand, hope, and he's waiting for the answer. So in the discussion, I would really want to ask the experts if you have period. If there are some advances in treatment done in this field of the disease. Bone marrow transplant is the cure, but in the early childhood forms of the cerebral disorder. And in this case, I would like to discuss what to do and how we can help Dan if possible. Thank you.
Thank you very much for a very interesting case. And now we are opening the discussion.
One comment: we have had the opportunity to see some patient with the adult onset form of the adrenomyeloneuropatija, and actually, at the best of my knowledge, what is the true hope for them is the gene therapy. You know, you have presented very nicely this case and the treatment that has been attempted in some patients around the world. So that is probably the way. That form has opened actually probably the next era of the gene treatment.
Yes, probably. I was wondering if even if gene therapy would be helpful, since the demyelination has progressed and the brain stem is already involved. It's a question that Dan already is severely depressed, and what I don't want to kill is his hope. And I promised him to tell him at least. I think he's critical and he knows probably the end of the whole story, but he's trying to find somewhere in the world if something has been done, maybe for next generations.
Well, in other disease, we know that gene therapy seems to work if you start very early. So it doesn't seem to work when the disease advances. So I don't know what would happen on this, but you can still help him to keep hoping that something might happen, but not many more.
The importance here is to make a diagnosis way early before the neurological symptoms progress this severely. We met him 3-4 months ago, so it was already advanced, probably before, and of course the genetic counseling since the first child was diagnosed.